Hello, how are you? I'm Dr. Alexandre Mota, a physical therapist, osteopath, and author of the digital book, Secrets of a Pain-Free Spine. And today I'm going to teach you two very practical exercises to help you reduce wear discomfort and pain in your kneecap. Welcome to Goodbye Knee Pain, Part 2. The return. But before we start, don't forget to like this video if you're watching me on Facebook, or hit the thumbs up if you're watching me on YouTube. Don't forget, if you keep watching videos, you'll forget to like this one. Hit like now so you don't forget. Don't put it off. In the last video, I shared a great exercise to improve leg bone alignment, femur and tibia, which reduces the compression on the kneecap that contributes to wear and patella chondromalacia. And today I'm going to teach you two exercises that will help you improve the mechanics of your kneecap, meaning they'll improve the movement of the kneecap and the nutrition of the cartilage. And just a reminder, cartilage is a structure that protects most of our joints. In addition to protecting, it also helps with movement, meaning it helps with the smooth movement between the bones and the other structures in the joint. And besides that, cartilage doesn't have nerve endings, which means you can't feel the cartilage. So it could be suffering, wearing down, degrading, and you wouldn't feel it. When you start to feel discomfort, when you start to feel pain, it's because the wear has already gone beyond the cartilage and has reached the bone itself. So that's a warning sign. If you're already feeling mild grinding sensations, stronger grinding sensations, or a sensation of sand in your knee joint, don't wait. Look for a physical therapist or doctor right away and start doing these exercises to prevent it, to slow down this wear and tear. And besides that, cartilage also doesn't have blood vessels. Then you ask me, Alexandre, how is that possible? If cartilage doesn't get blood, where does it get its nutrients from? Where does it get these nutrients from? How does cartilage stay alive? And I'll tell you, in most of our joints, there is fluid inside the joint, which is called synovial fluid. And it's from this synovial fluid that cartilage is able to get its nutrients. But for that, it needs good movement. You can even compare cartilage to a sponge. After you wash the dishes, if you want to get the detergent out of the sponge, you have to put the sponge under water and keep squeezing and releasing the sponge. That way, the water will circulate inside the sponge and remove all the detergent. The same thing happens with cartilage. Good movement causes the cartilage to undergo compression and decompression. This way, the fluid can circulate inside the cartilage and it gets the necessary nutrients from it. When there is misalignment or poor mechanics, it causes excessive compression on the cartilage, and this doesn't allow it to get the necessary nutrients. And this is one of the main factors that leads to cartilage wear. So what would be a good movement for the patella? The patella moves up and down. It goes up when you straighten your knee and goes down when you bend your knee. And besides that, the patella is guided along a sort of track. The femur bone has two structures, the condylus, which are on each side, and the patella slides between these two condyles. And in a healthy knee, the patella is centered in the joint. So it doesn't get compressed. It doesn't have a strong tendency to go inward or outward. Again, the patella is the triangular bone that sits in front of the knee. I'll draw on myself again so you can see. In most people, the patella is smaller. It's just that I have a big patella here, which is actually good because it makes it easier to see. And in the first exercise, we're going to work on the lateral and medial glide of the patella. For this, you should keep your legs stretched out and relaxed. You can rest your leg on the floor like I'm doing here, or support it on another chair, a small bench, or a table. This is important for us to improve the glide and improve nourishment to the cartilage on both sides of the track. You're going to use a grip that I call the duckbill, which is this one here on the outside of the kneecap, at this angle of the kneecap. And you're going to help the kneecap move inward. But pay attention. Most people, most professionals only do the movement of pushing inward. And that doesn't help. It doesn't promote the sliding between the kneecap bone and the track. So Ideally, you should work on it. You should push the kneecap, promote the movement in the direction of the track, and that's exactly the direction of the track. You're not just going to push the kneecap inward. You're going to push it inward and backward, thus helping the kneecap to slide, improving the sliding of the kneecap cartilage, and improving the nutrition of the kneecap cartilage. Remember, it's not just inward, it's inward and backward, as if it were a diagonal movement. To work on the lateral sliding, you do the opposite. Duckbill on the inside at the inner angle, at the angle pointing inward, and also push in the direction of the track. Remember, it's not just outward, it's diagonal, outward and backward, like this. Ideally, you should work in both directions, promoting medial sliding and lateral sliding. But since physiologically the patella already tends to move laterally outwards, ideally we should work by putting more emphasis on the medial glide, pushing the patella inward. One thing, something I personally like to do and recommend to my patients is that you do this medial glide at different degrees of knee flexion. When your leg is fully extended, it's easy to see this movement and to perform this movement. So what I recommend is that you bend your knee a little and try to do the movement, then bend it a bit more and try to do the movement again. Feel. As you keep bending your knee, you can even change your grip to use your thumb and do the movement, or use your whole hand. Just hook from the outside and pull inward. This way, you'll be working on several sections of the track. In the second exercise, we're going to work on the downward glide of the kneecap, meaning we're going to encourage the movement of lowering, of going down, and help the kneecap in this downward movement. This is important because in most people who have patella chondromalacia, there's also a postural misalignment known as high riding patella, which is my case. My kneecap, besides sticking out a little, should actually be lower down here. So much so that when I bend my knee, it stays up there, when it should actually go down more. So all these exercises I'm showing you are exercises I recommend to my patients and exercises I do myself. So do the exercises I recommend, and I know they work really well. And going back to the second exercise, which works on the inferior glide of the patella, you will also keep your legs straight and relaxed. And you'll grab the top part of the patella with your thumbs and with your index fingers. Hold near the apex, near the tip of the patella. 2. The movement you'll do only with your thumbs, pushing the patella down, but your index fingers will serve to guide the movement. So you can be sure that the patella is going straight down and not drifting laterally or medially. And the exercise is exactly this. You push the patella down and return. Push down and return. Push down, return. Push down, return. And the last exercise you can also do to work on the inferior glide of the patella is with the help of a chair. You'll place your opposite hand on the chair. That is, if you are going to work on your left knee, your right hand rests on the chair. You will place the base of your hand, the thenar and hypothenar region, with your finger above the patella. So you will place the base of your hand about a finger above the patella, and you will push the patella down without causing pain. And you will bend the knee slowly and as relaxed as you can. I just recalled some questions from the last video. First, there isn't a predetermined number of repetitions or times per day that you can or should do these exercises. Joint mobilization exercises should be done whenever you feel the need to unlock the joint. I recommend this to my patients. because it's a way for them to reconnect with their bodies, to start listening to their bodies again. I'm going to make a video talking about this in more detail. But what I find interesting is that most people, and this has increased a lot in recent years, don't take a moment to listen to their bodies. They know they have pain, but they don't know what makes it better. They don't know what makes it worse. They don't know what the best position is. They don't know what their body is asking for. And there are many people who have a very hard time listening to and reconnecting with their bodies. And for people who have a harder time reconnecting with their bodies, who have trouble noticing these sensations, this locking action, this need to move the knee, I recommend a minimum dose, which is to do this exercise every day for between 30 seconds and 1 minute. The second question is whether it's normal to feel pain or hear a popping sound during the exercise. The popping sound, as long as it doesn't cause pain, is very common, especially when you start doing joint mobilization exercises. And this popping sound tends to decrease, tends to disappear over time. It's the result of poor mechanics. As you improve your mechanics and the gliding of the joint, these popping sounds will decrease, and under no circumstances should you feel pain during the exercise. If you're doing the exercise and feeling pain, try doing the exercise with a smaller range of motion. Use less force. Try to adjust your grip just a little bit. Sometimes a minimal change in your grip makes all the difference and helps you avoid discomfort or pain during the exercise. And now the last question. Should you work only with the affected leg, the leg where you feel pain, or should you work both legs? Ideally, you should always work both sides. Always work both legs. Because even if you only feel pain in your right knee, for example, your left knee compensates for it. This happens even at a subconscious level. Do you feel pain, discomfort, or some dysfunction in a region of your body, in a joint? You try to protect that area and end up putting more strain on the other. It's not uncommon for someone to say that their knee was hurting and then the pain moved to the other one, or their elbow was hurting and then the pain moved to the other. This happens because of compensation. So if you have a dysfunction in your body, in your knee, for example, you should work on the other one to prevent it from suffering compensation and causing problems. It will probably become dysfunctional in the future. And now it's time to share. Let's help these videos and tips reach more and more people. Show this video to your family, your friends, share it on your social networks. Here on Facebook, here on YouTube, on WhatsApp, on Twitter. And I have one last question for you. I want to know what you would like to see in the next videos. Leave a question, a suggestion, or a topic you'd like to see covered about quality of life down here in the comments. What do you think is missing for you to have a better quality of life? Don't forget to leave it here in the comments. It's very important for me to know how I can help you in the best way. That's it for now. Take care and see you in the next video. But before starting the video, don't forget to like it if you're watching me on Facebook. Or hit the like button here if you're watching me on YouTube. And it's the same with cartilage. Hi, dog. The femur bone has two structures, the femoral condyles. How many times a day can you do this exercise? Movement, work. Go for it.